just wanted to jump on and talk a little bit about urinary catheterization. This is something you're going to see a lot of as you continue in this program and as you go to various different placements. A lot of clients within the hospital setting may have a catheter for some period of time during their stay, their post-op, things like that are really common places where you're going to see them. Okay, so when we're thinking about this topic, we're really thinking about assessment of that urinary system. So even looking at things like skin and the mucous membrane, are they moist? What's their skin turgor like? It's going to give us a good sort of assessment of sort of some of their hydration status. Okay, we're always wanting to inspect things on the abdomen, like looking for distension of the bladder above that symphysis pubis, asking about any pain or tenderness over the area of the kidneys, because anything like this is going to let us know that they might be experiencing a sort of infection or inflammation. The other thing that we're really looking for is that urethral meatus, so observing for any discharge and inflammation in that area as well. The other thing to really point out that's important when we think about catheterization is that the length of the male urethra as compared to the female, the male is going to be quite a bit longer. So this is actually going to put the female at a greater risk for urinary tract infections just because that urethra is so much shorter. Okay, and so in addition to sort of looking and assessing, we're always looking too at the characteristics of urine of our client. Okay, so we're looking at, how often are they voiding? How much are they voiding? Is it a small amount each time, many times an hour, or are they voiding a sufficient amount every 2 to 3 to 4 hours? Okay, so we do a lot of recording in terms of intake and output of the client to help us to monitor sort of kidney function. Okay, when we're looking at urine, so we're monitoring intake and output, we're also looking at the characteristics of their urine. So looking at things like the color, the clarity, and the presence of any odor. So any odor is again going to be a sign of infection. Okay, and we just want to know sort of a lot about the different patterns that they have. So do they have dribbling? Are they up in the night to pee? Do they have any hesitancy before they start to initiate that stream of urine? Anything like that is going to give us a lot of information about the bladder, about the kidneys, and their elimination patterns. Okay. So again, when we think about intake and output, we would think that the average adult would intake about 22 to 27 mils per day. Okay, they're going to take some of that liquid in through their oral intake, some liquid through their foods. Okay, and most output through the kidneys is about 1,200 to 1,500 mils per day. So we're monitoring that and looking for that when we calculate their intake and output for the day. We're also looking hourly, so anything less than 30 mils for more than 2 hours would be reportable, as well would be anything over 2,000 to 2,500 mils would be reportable as well. Okay. There's many different specimens that we can collect as a way to evaluate kidney function. Some will look for things like protein in the urine or other microorganisms for urinary tract infections. So there's a variety of ways that nurses go about collecting specimens that are then sent in to the lab. Okay, so when I think about our nursing role in relation to catheterization, it really to me is sort of assessment of the client and their urinary patterns, helping them to maintain elimination habits. So thinking of things like providing time. A regular toileting schedule will help individuals maintain their elimination habits, providing privacy. Okay, and just helping people to feel relaxed to be able to do that. Okay. Other things that we do is we administer medications that help with aiding in emptying of the bladder or contracting that bladder. Okay, so that would be something else that we have a role in. And then the other thing that we do is we're involved with catheterization. Okay, and so catheterization is generally used for individuals experiencing incontinence or sort of obstructions of the urethra. Okay, and there's two types of catheters. There's intermittent catheters and there's indwelling catheters. And so we would call the indwelling, you would hear it likely as that Foley catheter. Okay, so the intermittent is sort of what it sounds like. It goes in, we empty that bladder out, and once that bladder is emptied, we then remove that catheter. Okay. Where we see this a lot is individuals with MS or spinal cord injuries, where they would actually even self-catheterize every 4 hours or so. The other place that we see it in is post-op. If an individual had a catheter post-op and it had been removed, and then they're having difficulty voiding, sometimes we'll use an intermittent or an in and out catheter that goes in, empties the bladder in an effort to help that bladder regain its tone. Okay? We can see that also postpartum. If a woman is having difficulty voiding after a vaginal delivery because that baby pushing on that bladder for so long, sometimes an intermittent catheter can help again that bladder to regain its tone. Okay. So when we think about catheterization, remember it's a sterile procedure. That bladder is sterile. Okay, so we have to really consider that when we're putting in those catheters, and we have to maintain a closed drainage system. Okay. The other thing to think about is that if a catheter is removed, an individual should be able to void normally after removal. So if they're unable to, there's something going on there. Okay. So thinking about helping them with that and identifying and notifying their primary care physician if they're having difficulty after removal. Okay. The other thing to think about with indwelling catheters is that there's a 2 lumen and a 3 lumen. Okay, so thinking about the 2 lumen is inserted, and one of the lumens is going to drain the urine. The other is going to be inflated with the water to hold that balloon in place in the bladder and hold that catheter in place. Versus a 3 lumen is going to have an additional lumen to that, which will be used for continuous bladder irrigation. Okay. And so bladder irrigation would be used after something like bladder or prostate surgery, and it helps to remove and prevent blood clots and blockage of that catheter. And what happens in that is that we actually are washing that bladder with sterile water. Okay. So that would be what you'll see mainly is the 2 lumen, but if someone does need the irrigation, they will need a 3 lumen catheter. Okay. When I think about catheterization, the insertion of a catheter shouldn't be overly painful. It may be slightly uncomfortable for the client, but it shouldn't really be really painful, and having the catheter in should also not be painful. So if they're experiencing a lot of pain, it kind of lets you know that there's something going on there. Ways that we can prevent infection and also to prevent it from being painful for the client is to secure that catheter to the leg. Okay. Performing catheter care is really, really important, at least 3 times a day and with bowel movements as well. Okay. Keeping the drainage bag below the level of the waist so we don't have the urine going back into the bladder, because that can increase risk for infection. Okay. Looking for signs of infection is also really, really important. Even if a client had a catheter removed 2 days ago, they still are at risk for infection. Okay. The other thing to remember for the catheter is that it does require a doctor's order. So you need one to insert a catheter, and you also need an order to remove a catheter. So making sure that you have those orders and that you're checking them before you just remove that. Okay. The other thing you might see with male patients is the condom catheter, and it's really that condom-like sheath that's going to fit over the penis. Okay, this is a more non-invasive way to contain urine. So we'll see it a lot with clients that have incontinence. If there's a lot of redness and skin breakdown, sometimes they'll try the condom catheter to keep that urine off those areas of the body. Okay, some clients, they work well, and other clients, it bothers them and they don't leave them in place, or they won't stay in place well. It sort of depends on the client, is what my experience with them has been. But really assessing then that penile shaft for any redness, swelling, and irritation and skin breakdown is really, really important where that catheter is applied. Okay. The other type that you will see is the suprapubic catheter, and that is really the catheter that actually goes right through that abdominal wall into the bladder. Okay. And again, we're providing catheter care and many of the same principles as the indwelling catheter for that type of catheter as well. Okay. So that's really what I wanted to cover in terms of this topic. I would suggest that insertion of the catheter is definitely a skill that needs a lot of practice. It's definitely harder in the female patient because it's more difficult to see that urinary meatus where you're going to be inserting that catheter. So lots and lots of practice and review of that skill in your lab will help you with that. I hope you have a good week.